As cities across the U.S. face sub-zero temperatures, shelter space for migrants is becoming more and more scarce. This is video from Chicago, where the city last week suspended its 60-day limit on shelter stays through January 22nd. Denver has also temporarily stopped enforcing shelter evictions due to the cold weather. And in New York, migrant adults have maxed out city shelter limits, but families can apply to extend their stays. Dr. Evelyn Figueroa joins us now. She's a professor of clinical family medicine and the director of the Pilsen Food Pantry, which provides health care and screening and food for migrant families. Doctor, thanks for being with us. You're on the ground. What's the main problem?
Good evening, Catherine. Oh, gosh. Well, we are 17 months into the new arrivals coming to Chicago, and a lot of us have stepped up to help the 30+ thousand people that have come forward, but we're really struggling with just developing systems and improving communication between the community-based organizations and the city and the county and the state.
It sounds like what you're trying to develop is a long-term process and strategy, because these people you may have thought were only there temporarily, but now it seems that they're staying for months on end.
Yes. Well, depending on the year, there are thousands of migrants that come to Chicago seeking refuge, seeking asylum, and coming for a myriad of reasons. This is not new to Chicago, but it seems like when we have a big wave of migrants, we're not necessarily learning from our past experiences. Our immigration laws in the United States haven't been updated in about 5 decades. And I think we need to change with the times and be a little bit more swift and nimble in order to accept our newest Americans.
So let's talk about the logistics here and the limited shelter space. I mean, not only in Chicago, but other cities across the country, and not just migrants, but for all homeless populations.
It sure is something. I have been doing homeless spacing work for my entire career in family medicine. I've been a family doctor for nearly a quarter of a century. And, I just don't know if we all agree that housing is a human right and that everyone should be housed. It's a fundamental and very basic understanding to have in order to really reach consensus and allocate sustaining resources rather than reacting to new people experiencing homelessness, us really accepting that it's not safe or sustainable for people to live outside. We know that people live between 11 to 15 years longer when they're chronically homeless. We understand how vulnerable that is. We know that it undermines every health condition that exists and, of course, is extremely traumatic. This is a problem with a solution, but it really depends on us deciding if everyone deserves to be housed. Chicago, prior to COVID, had 4,000 city-funded emergency shelter beds, and now we are at, quadruple that amount. We were able to do that, and that to me indicates that we can free up resources and be responsive, but you have to do that in partnership with modernizing immigration laws. So for people that are residents of Chicago, that are citizens of the United States, that's very different in terms of plugging them into resources. For people that are unable to legally work, we're going to have to do something to help people that are able-bodied be able to get into sustainable living conditions.
Just in the final few seconds that we have, border crossings typically during the winter months have declined. This year is much different. Does that take us back to the policy question again?
It absolutely does. I mean, to me, it is strange that we are moving people across state lines, which is human trafficking, and that we are not stepping in at a federal level to really try to get us all to sit at the table and improve conditions for immigration, and to support the border states, and to also support sanctuary states and cities.